Scott Healy. I'm CEO of Psych Hub.
What inspired you to become an entrepreneur?
So I started my career long ago doing kind of the safe big company kind of approach. I was a consultant early in my career, like a management consultant. And I worked for Unilever, and when I was a consultant, I worked with companies like Sears back in the day. So big companies. And I enjoyed it, but then I had a bunch of friends that I went to school with who were doing startups, and we'd get together, and the stories that they had to tell about their days and what they did in the past week, like, were a lot more interesting than mine. And so I started getting intrigued by that, and back in, I guess it was 25 years ago, joined the first of five or six startups that I've been a part of, and while it was that one in particular was super stressful, that transition from being kind of a big company person to going to a startup that didn't have much revenue and didn't really have customers that liked what they did and had a lot of issues. But so it was very stressful, and it was a super intense roller coaster ride, but it kind of fulfilled what I hoped it would in terms of being exciting and engaging, and also just you can make a bigger difference in a startup than you can in a big
Yeah.
company. And so I was pretty young at the time, and I got an opportunity to do more things and have a bigger impact. And then I got the bug, and I've been at it ever since.
Yeah. How did you get the entrepreneurship intersect with mental health and all that?
Yeah, so the first, I guess, three startups that I was part of weren't necessarily, they weren't related to healthcare, they weren't related to mental health, they
Yeah.
weren't even really mission driven. They were basically software businesses. And then I helped to start a company called Care.com. And Care.com is most known for helping people find childcare and senior care and other forms of care for your family. And so I was there for a long time, like almost 15 years. And um, we grew from zero to being the biggest marketplace for family care in the world. And as part of that process, we really got to understand the challenges of parents. I was also a young parent myself at the time with four kids, and it really stood out just the care the mental health impact of the burden of caregiving, particularly for people that are working. So people that are trying to juggle caring for kids, oftentimes caring for aging parents, having to work, worry about paying the bills. It was a serious source of stress for people. And so having been through it myself, being part of that sandwich generation, but also dealing with all of the users of care.com and getting close to them. And that became a big part of our mission, was not just how do you find a good caregiver, but how you support people along the way. And so after a long time at Care, I then went to a company that was fully immersed in the healthcare space, healthcare education. It was called Ascend Learning. And one of the businesses that we had there was a mental health training business for K-12 and higher ed faculty and staff and students. And that really opened. It was the first time that I've been in a business that was focused on mental health, and I saw the impact that we were having. And it also, at the same time, really over the course of the previous 10 years, I'd been dealing with issues within my own family, ranging from addiction to kids with relationship issues at school to eating disorders. And I mean, I think there's nobody that hasn't experienced, kind of a personal
Right.
impact related to mental health. And so for me, as I was thinking through all the things that were going on in my own family, I just found it really satisfying to be immersed in the mental health space for work. I'm somebody that's not very good at, being kind of partially engaged at work and then doing lots of proactive things outside of work. I'm pretty much all in on what I'm doing in
Yeah.
my day job. So I decided I really wanted to go all in on mental health and behavioral health and helping to solve problems that are still huge out there. And so um, I met Patrick Kennedy, former congressman, who had his own issues with addiction and mental health, and really over the last 15 years has been a huge advocate in the space, for better treatment and better training and education. And so Patrick and a woman named Marjorie Morrison, who's a therapist by training, but really a mental health entrepreneur, started Psych Hub about 5 years ago. I met them about a year and a half ago and joined the company about a year ago to help run it and help grow and expand it. So that's how I got here.
So what is Psych Hub?
So Psych Hub is so back to kind of the mission and why we were founded. The premise on which we were founded was that mental health practitioners in general are trained as generalists. And so most therapists are licensed social worker by training. Many go on for additional training, but they're often trained really to kind of help people in a broad way, and don't there aren't many educational programs that many go through that get very specific about evidence-based practices for given conditions, for cultural backgrounds or other factors that are gonna impact your the success of your treatment. And so Marjorie and Patrick started 5 years ago building a really engaging library of video-based training content that is based in evidence-based practices and is focused on kind of two populations. One was practitioners to help them upskill and again learn those evidence-based practices to have better outcomes for their clients and patients. And then the other is consumers, and we've created over 500 videos. Many of them are available on YouTube, on our YouTube channel, and we get millions of views around people that are doing research for themselves or for a family member or loved one, just trying to understand kind of, okay, what's going on here? What's this condition that I or my kid or my spouse or whoever is struggling with, and then what can I do about it? So we created a lot of what's called psychoeducation content for consumers, kind of upskilling and continuing education for practitioners. And then recently we've been in kind of that education training business and and have built up a pretty good following in that. And then we said, well, hey, we've got all these consumers looking for care or looking for solutions that they watch our videos. At the end of our videos, we basically say, hope you enjoyed that and good luck. And so we added a new offering, a care navigation um, resource that's free for consumers just about 4 months ago, that allows them to take a well-being assessment, get guidance on what their needs are, and connect to a vetted set of practitioners in the space that follow evidence-based practices, which is really, again, back to our mission. It's really all about how do we promote evidence-based practices, better outcomes, and then connect consumers to those high quality resources.
Yeah, for me, I live with bipolar disorder too, and I see a therapist only like 2 hours a month. So there's a lot of time I have questions even about what I'm going through and all that. So how important is it to have a platform that's around 24/7?
Yeah, no, it's huge. I mean, so originally we created a lot of that consumer content as part of our mission, and again put it publicly in places like YouTube. And then we saw that there was a demand from practitioners, particularly given the shortage of therapists and
Yeah.
practitioners. It's like it's hard to get appointments, it's hard to meet with them as frequently as you want, or it's just not convenient. And so we saw an increasing demand from therapists to complement their treatment there and sessions with patients with kind of prep work on the way in, homework between sessions, and the ability to kind of point their clients and patients to content that would augment what they were talked about in their previous sessions. So that so we're seeing a lot of that's more of a trend now. So therapists are trying to see, how do I leverage digital content
Yeah.
technology for better outcomes. The other thing, I mean, there's research out there that I think it's the Mental Health Foundation did a study, and 70% of people who have kind of high mental health literacy, so kind of understand their situation and kind of know the context around it, they're 70% are likely to seek help for mental health issues. And for people that are rated kind of low on the literacy scale, only 40% are. So I think just being aware of kind of it takes some of the stigma out of it by just having knowledge to say, okay, I understand what this thing is that I'm going through. I understand kind of the options for treatment. Those people that have that base level of understanding are way more likely to actually seek treatment and get help and get better. So there's research out there. There's a lot of studies now that show that kind of consumers being more informed about mental health and learning about it leads to them being more open to treatment and having better outcomes.
I was actually just going to ask about that with mental health education. How does that help misinformation or lessen the stigma?
I think it's, one of the approaches we take is we have, our videos are mostly, it's subject matter experts who are, who are really kind of the leaders in their field, but we also usually include discussions with people going through treatment or struggling with a given condition. And I think just hearing somebody else talk about that and and we also are careful to have lots of um, representations of different
Yeah.
backgrounds, cultures, ages, genders within our videos. And I think just when you hear somebody or see somebody that's going through something that you are, and
Yeah.
it's somebody you can relate to, it resonates with you. I don't know if I mean people like I think people like Simone Biles
Yeah.
has had, or Michael Phelps have had a really big impact on people's willingness to seek help also. When somebody who's kind of a put on a pedestal literally with medals and is willing to be open and talk about it and be vulnerable, I think it helps to reduce the stigma. Now the current there's some headwinds in the current environment that a lot of people are dealing with, but I think in general the movement is towards greater acceptance, and I think that comes from people that are kind of well known and respected. uh, you know Celebrity types helps,
Yeah.
but also just the number of people out there online openly talking about their issues, even with they don't have to have millions of followers. They can just be people that are out there, and there's lots of people, as you know,
Yeah.
online talking about their conditions. And I think that's really made a huge impact in the last like 3 to 5 years. Really coming out of the pandemic is where it's really accelerated.
Well, I know for me, that's the biggest thing that helps me is hearing other stories about people with lived experiences. And Patrick Kennedy is one of the biggest ones that talks about his lived experience. What is it like working with him and having similar missions?
Yeah, no, he was one of the main reasons I came here. His story is inspiring. For those who aren't aware of it, the short version is he was one of the youngest congressmen ever elected to Congress. Obviously, his father, Ted Kennedy, senator, huge in the Northeast, Massachusetts, where I am, and but also they had a family history of lots of addiction issues, kept under the covers, not really talked about publicly, and mental health issues. And so Patrick kind of soldiered his way through 7 terms in Congress while struggling with, uh, multiple things, including drug and alcohol addiction. And it's amazing that he was able to be effective during that time. He actually one of the main things that he passed, his kind of biggest signature legislation, was passing something called the Mental Health Parity Act, which legislates, he says it great, it's basically legislates that insurance companies have to treat your mind as if it's part of your body, or your brain as part of your body. Because it's just historically, it's been harder to get insurance coverage
Yeah.
for mental health and for physical ailments. And so that was a major piece of legislation that's still having impact today and increasing in impact. And anyway, he kind of hit rock bottom at a certain point in Congress. Eventually got out, got his really kind of got his conditions under control, and he's just an inspirational person in terms of kind of the real life challenges he's gone through. He's incredibly empathetic for anybody that ever comes to him for help, or for themselves or for a family member. He'll drop everything or drop anything to help them. And so he's just a great person whose vision for this was inspiring, and who I want to help bring that to reality. So, but he's also the kind of person that, as a former politician, he will do anything to help the business as
Yeah.
well. So he's the kind of person that opens doors, will make an introduction to anybody. I mean, we were with him, I was mentioning to you before, we were with him down in DC last week at a conference, and the number of people that he connected us with who can help Psych Hub on our path forward was super valuable. So he's a great person. He's a board member, so he doesn't work in the day to day of the company, but he's a very active board member, and a great person.
And with mental health education, how important is it to have young people learn this at an early age?
It's a good question. I think it's it's going back not too long. It was kind of taboo to talk about that with
Yeah.
kids. I actually have at risk of one of my kids giving me a hard time for telling this story. So one of our kids, who's a twin, started having issues in school starting in kindergarten. And I just had always, I think they initially coined it as touch sensitivity. So anytime anybody touched him, he thought that they were attacking him and would react in inappropriate ways. And that was the first of a few things with him that just kind of that kept coming up as, something's a little off here. And so when he, I think for the second time, got suspended from school for various things by the time he was in middle school, the school counselor said, "Hey, he should, we recommend that he get counseling from a therapist." So we took him, and he went through probably 3 months of weekly sessions. Back in the day, and this is going back 15 years or so, there wasn't a lot of sharing with the
Yeah.
parents. So the therapist was like, "He's good. He's a good kid. Nothing you need to know." And then at the end of about 3 months, the therapist said, "Okay, I think he's all set. I think he's." And so we went to our son and said, "So you don't need to do these sessions anymore. Sounds like everything's going well." And he said, "Actually, I'd like to keep doing it." And he kept doing it. This is at age, I think, 10. So he had a therapist, for a couple of years, age 10. So that's an anecdotal story, but he's doing great today, 10 plus years later. And I think it wasn't ideal, like why he got introduced to the concept of taking care of his mental health, but it really paid off for him, like as he's kind of moved on and kind of turned into a more productive member of society than he was looking like he might be at 10 years old. So I think it's fine. I think the content has to be, it's actually something we're focused on expanding into, but we have some content that's focused on for children, but obviously it has to be something that resonates with kids and speaks to them in
Yeah.
language that they understand. And so, we're big believers that, once somebody gets to the point of, probably kind of like by middle school, maybe late elementary school, knowing that, there's help for them if they're struggling, is really important.
How does it feel for you for this to make an impact?
Um, really big. I mean, and I'm one of the things that motivates me is, we're still a startup, we're still a relatively small company. How do we have a bigger impact? And as I mentioned before, I'm the kind of person that whatever I'm doing during my day job, I get fully immersed in. And so, Care.com was the first company that I was part of that really had a strong mission. So we had a mission to, again, to help help parents or caregivers find high quality care, but also to help caregivers have a more sustainable profession, basically an occupation, because that's a tough one to make good living at. So we had a really powerful mission and made a big difference in that space. And so having been through that, that resonated with me as something that's important to me kind of for my career going forward, that, whatever I do, uh, to help pay the bills, I want it to be something that also, is making a difference in society. And so for me, um, I think mental health, I don't think there's a better place to be focused right now than
Yeah.
mental health. Obviously, there's an epidemic around anxiety and depression and suicide, particularly in young people, um, but really spanning generations, ages. Like everybody in society has struggles, and so for me, if we can, if over the next kind of 5 to 10 years we can play a role in reducing stigma even further and elevating the quality of care from practitioners and connecting people to high quality care and helping to be an entity that helps people figure out what's the right care for me and like where's higher quality versus lower quality care. Those are things I think will fill a pretty big gap that exists today. And there's resources out there online, but people have to kind of hunt and peck and go through a frustrating process of finding caregivers who have availability, who take their
Yeah.
insurance, who are actually trained in what they have. And so, I think the same way we created a kind of a new category at care.com of an online marketplace for care, we think there's an opportunity to just have a better user experience online to help people find that the right care for what their situation is today or for their loved ones. I mean, a lot of times
Yeah.
it's not just for themselves, it's a parent or a family member or a friend or a colleague who's, trying to figure out how do I, like, not just what's the right form of care, but how do I engage? How do I get the person engaged? Like, how do I actually effectively get them to consider doing something that's going to help them? And so it's interesting. This wasn't why we were founded, but we saw there's a lot of demand in just normal companies. So not just
Yeah.
not just healthcare companies, but companies are increasingly paying for training for managers and their staff and HR people to basically become what we would call mental health allies. So how do you, even if you're not going through something yourself, how do you have your antenna up to be more aware of what the person you're working next to might be going through, or to kind of keep your eyes and ears open for signs that a person might need help, and how are you supported through that process? How do you refer them to care? How do you talk about things with them in a way that's helpful and not a turn off and something that causes them to kind of shut down further? So anyway, it's interesting that there's opportunities in the healthcare setting, in schools, in businesses,
Yeah.
just trying to support their employees. I mean, it's the whole like K-12 and higher ed space is a whole other area of where there are companies that focus solely on kind of better mental health in schools and universities, and that's just a whole other area where there's big need.
I know for me, I want to be a leader in the mental health media video space. And sometimes with having bipolar disorder too, I think the stigma may be a lot for me not to do that. So I get nervous on my own. And I know there's other people, lived experience or not, that are nervous about being leaders. So what would you say to anyone that wants to follow your footsteps?
It's funny. I would, first of all, and there's different kinds of leaders, right? But just as a kind of a funny thing, but I think it's true that I actually heard this from um, a founder, an entrepreneur of like a major clothing brand who really struggled with his own mental health, ended up leaving the business as a result of that and moving on to take a break. But basically, I think in order to be a founder and to kind of have the um, kind of some combination of self confidence and often um, delusional, glass half full belief that something can work. Like there has to be something. Like you're not. You don't. It's a different kind of person that has the combination of things necessary to start something from scratch. And I think that there's kind of the prevalence of um, mental health and mental well-being issues amongst founders is very high, like higher than the average, the general population. That aside, so I'm not saying that's what you need to do to be a founder, but there's a difference between being a founder and a leader. So I've always wanted to start my own thing, but I concluded pretty early in my career after started going to these kind of startup companies that I took a few swings at with a small team of trying to figure out, okay, what are we going to start, and how do we go after this? And I concluded through a few swings at that I'm the kind of person that's better joining something where there's some level of traction already versus starting from scratch. So those are two different camps. But so. I think anybody can be a leader in
Yeah.
something that starts from scratch, and I think it starts with whatever, like taking being a leader in both uh your specific part of an organization that you're in, and taking ownership of things, and figuring out how do I drive things and make a difference. Like to me, that's where leaders stand apart. It's not about how do I like keep the train on the tracks here, and um how do I keep my job? There's a different mindset. It's more about, okay, how am I going to like take this thing that I'm part of and make it way better than it is today? And I think anybody who has that mindset and is willing to, um, kind of, be, um, be creative, but also kind of realistic in kind of the plans they put together to go after that. People who have that kind of combination of kind of drive, creativity, and then kind of judgment. Like I'm not going to just do crazy
Yeah.
things with a very low chance of success, but I'm gonna put in the work. I'm gonna do the analysis. I'm gonna figure out, like, I'm gonna assess our options. I'm gonna figure out how do we move forward. Like people that kind of operate that way, I think anybody can be a leader. I think um, I mean, one other thing I would say is key to leadership is not being afraid of failing, right? And I think oftentimes the people that don't kind of go for it in a leadership role, or kind of stick their neck out to try to get one, it's because there is this kind of, well, what happens if it doesn't go well, or in general they're conservative in the types of things that they want to do in their business. And again, back to kind of, if you want to make a difference, you have to take risks, and you have to be, I think, the same way there's reducing, not far from gone, stigma around things like mental health. There's also like way reduced stigma in just business of failing, right? So you look at a place like, I mean, it's probably most prevalent in a place like Silicon Valley, or the Bay Area, but people like start businesses and fail all the time, or they try a new initiative and fail. And even if you like crash and burn whatever it is you're trying to do for a business, and you lose your job or the company hits the skids, like those people are totally hireable and just jump right into the next thing. So it's I think that whether it's investors or people that are looking to hire, people like to see somebody that's being aggressive, um, and it's okay to fail as long as you're learning from failures. If you fail, you need to be able to say, okay, like this is what happened. I did it for these reasons. It didn't work, but now I know going forward that these are the things I learned. And so that failure comes with a lot of learning and can be valued. Without getting into the gory details, I had the first company that I was CEO of, actually left Care.com to go run a company. And it turned out to be a good lesson on a number of fronts. The company didn't go well. But I learned a ton, and came back to run other bigger and better things. So I think that's long-winded to answer your question, but I think you know going for it, not being afraid of failing, and making sure you learn through failure. Those are the keys to, and I think anybody can be a leader as long as they're willing to do those things.
What do you do to help your own mental health?
Um, I find that to me, it's a combination of I think the most important thing, because it can be kind of stressful being a CEO. I've gotten pretty good over the years of not worrying about things that I can't control and not spending time on them. So I might be disappointed if something doesn't break our way or my way, but I'm pretty good at compartmentalizing and saying, okay, like that I couldn't have impacted that, or even if I could have impacted it, that's now in the past. So what are we going to do going forward? So I mean, so part of it is just kind of being able to compartmentalize and think about how do I solve problems and move going forward. But I think so. That's kind of a work style thing. The other thing for me, I guess, two things for me is like trying to exercise, get outside, get away from work, breathe fresh air. That's important. And then also always having something that's like I like doing kind of I like building things and doing home improvement projects and things like that. So I always have some kind of project going on the side, and I find that those are it's less for the outcome of the project, it's more for just the completely mind clearing impact of being able to just immerse yourself in something that's very different from what you're doing in your day job. So those are a couple things that I do. And then I think I guess the last thing I would say is um, I I don't I have in the past but don't currently do therapy, but I'm a fairly religious person, and so for me, kind of prayer and meditation, everybody has different forms. It's actually surprising the amount of, as we see people looking for therapists through care.com, the number that are specifying like a specific religious background of a therapist that they want for. So there's an overlap between kind of mindfulness and the kinds of things you learn in therapy and meditation and religion. So for me, it's a combination of kind of prayer and meditation, but also just believing in something bigger and kind of being optimistic that there's going to be a good outcome. Like for me, that's helpful.
And you touched on it a little bit, but where do you want to see your mission, say, in the next 3 to 5 years?
Yeah, I mean, I think, yeah, I mean, so I mentioned that we expanded from training and education to helping connect people to care. So, it's an oversimplification, but to some extent, we aim to be the care.com for mental health. We just think there's, if we can in 5 years from now, we can be known as like the destination that people go to when they're looking for not only information about mental health, but for kind of transparent and objective options for where they can seek care from people that are using the most current evidence-based practices that have the best results and outcomes for their clients and patients. That's, if we can take that burden off of people, just the concern of how do I find good care and how do I know if I'm getting the best care for my mental well-being, then that'll be a good accomplishment over the next 5 years.
How can people reach out and learn more?
You can go to psychhub.com and there are a few things you can do there. One, you can access a lot of our articles and video content that help you as a consumer. You can also take a free mental well-being assessment, kind of take a personal mental health checkup, and kind of see where you stand. And then if it is the kind of thing where you're looking for your help, then you can connect to care. You can also check out the Psych Hub YouTube channel where there, as I mentioned before, over 500 videos specifically for consumers, not for practitioners, where you can, seek help and guidance and psychoeducation and mental health literacy. for yourself and your loved ones.